Welcome back. This is Angela. I'm glad to welcome you back to the fourth week of the HIT System Lifecycle Management course. And our discussion topic for this fourth week is system analysis, planning, and design. So let's talk about three phases. Let me take a step back. Have you noticed that the course is called Life Cycle um, and when I think of healthcare information systems, I think of all the different systems within healthcare, the cardiovascular system, the renal system, the urinary system. And healthcare information systems and IT are very much like that. A system that has multiple functions, has multiple components, but has a life cycle, has a start, so an initiation, an implementation, and or analysis, planning, and design. Analysis is usually an assessment. What's the problem that we're trying to deal with? What's the initiative? Why are we doing this? Where do we want to be? What kind of system do we need? What issues are we trying to solve? That's what I think about when I think about the phase of analysis. A lot of detail is needed, a lot of foundational work, a lot of the beginning assessments of what are you going to do, why, who, what, where, when. What system are we going to purchase? Do we need a out-of-the-box system? Do we need an integrated system? Is this an enterprise medical record, or are we just talking about one best-of-breed or a niche system such as a lab or a radiology system? When I think about planning, you need to start thinking about things like the RFPs, the RFIs, project charters, getting together a project team. A lot of steps go into planning. Do we have the necessary funds? Have we budgeted for the system or the initiative? Design. We've talked about usability and human factors. We've talked about process redesign. So three phases of the system life cycle: analysis, planning, and design. A lot go into each one. If you skip one phase, if you skip any one of those phases, you're usually going to really be in trouble. Talking about the roles that correlate with the phases of system analysis, planning, and design, I always think of stakeholders. Think of stakeholders as anybody who has a stake in the project or the initiative, and that can be from the C-suite, the chief executive officer, the chief information officer, the chief nursing officer, all the way down to the patient. The patient is always a stakeholder in healthcare information systems because what we do is going to impact them. After all, this is healthcare information systems. So think of the patient always as a stakeholder, and then anybody downstream or upstream who could be impacted by the project, the initiative, the EMR, the lab system implementation. And think about end users, whoever is going to actually be using the system. And end users can be a department head to the actual technician, staff, RN, person at the bedside, an end user, or a provider. Champions, I like that term better than super users. To me, a champion is a super user on steroid as opposed to a super user. A champion is literally going to champion the change, champion the initiative to their peers. I have worked with physician champions. I have worked with nursing champions. I have worked with department end user champions. And I like that term. It's coming into vogue recently in the last 5 or 6 years, as opposed to super user, but they are used interchangeably. Sponsor or an owner. Each project, each clinical initiative, clinical information system, healthcare information systems needs to have a sponsor and an owner. Sometimes, again, those terms are used interchangeably. I'm used to using a sponsor as an executive sponsor, and the person who is at the highest level in the organization, whether that be the owner of the clinic, if it's an independently run or an owned clinic, or whether that be the chief information officer of the hospital or the chief nursing officer. but there needs to be an executive sponsor of every initiative and every project so that you can ensure that you have the budget necessary and you have the funds necessary, and somebody who you can escalate up to issues, somebody who is also going to be the buck stops here, so to speak. That person is going to be the organizational sponsor of the project. You don't have one of those, your project is likely to languish, your initiative is likely to languish. And then an owner, sometimes that's different than the sponsor. Sometimes the executive sponsor is, as I said, the chief information officer, somebody in the C-suite, or the chief operations officer, and the owner is the department head. So you'll see that you sometimes need both of those people. You're going to need somebody who can ensure that you're going to have the staff and the resources to carry out this initiative, whatever it may be. Those are some of the key roles. Those are roles that I've seen across the industry, across the United States, across hospitals, clinics, outpatient surgery, and those are roles that relate to and correspond to the system analysis, planning, and design. In analysis, you're going to want to assess what's the issue, why are you doing this. You're definitely going to be touching probably the stakeholders. The stakeholders are going to be telling you, they're the ones that are going to tell you why we're doing this, where we need to go. Or it may be your sponsor that's driving this. This may be part of the organizational strategic plan that's driving this information system implementation. Planning, you're going to be tapping into your all four of those roles, all of those roles, your stakeholder, your end users, your champion, your sponsor, your owner. You're going to use them, and they're going to be in and out of the planning phases in varying levels. Planning in relationship to executive and your executive sponsor, as far as timelines, as far as budget, as far as resources, probably for both your sponsor and your owner, because they're the ones, your end users can't guarantee that you're going to have those resources. The executive sponsors and the owners can. Your end users you're going to be looking to as far as planning and design, because you want to make sure you're implementing systems that really are going to be adopted. So you just don't want to put it in and say, okay, we've done our job, we've got it live. You want adoption. So your stakeholders, your end users are going to be key in that. Good design helps with that adoption. Good planning helps with systems adoption. And that's probably all I have to say right now for system analysis, planning, design. Carry on.